What is the shape of the heart? A. Spherical. B. Cylindrical. C. Cuboidal. D. Cone-shaped. Correct answer, D. The heart is a hollow, cone-shaped muscular organ. What is the approximate length of the heart? A. 6 centimeters. B. 9 centimeters. C. 10 centimeters. D. 12 centimeters. Correct answer, C. The heart measures approximately 10 centimeters in length. How many layers make up the heart? A. 3. B. 2. C. 4. D. 5. Correct answer, A. The heart has 3 layers, which are the pericardium, myocardium, and endocardium. Which valve guards the opening between the right atrium and the right ventricle? A. Pulmonary valve. B. Tricuspid valve. C. Aortic valve. D. Mitral valve. Correct answer, B. The tricuspid valve, also called right atrioventricular valve, is located between the right atrium and right ventricle. Why is the left ventricle thicker than the right ventricle? A. It receives blood from the lungs. B. It produces cardiac enzymes. C. It controls oxygen intake. D. It pumps blood to the whole body. Correct answer, D. The left ventricle requires more muscle strength to pump blood through systemic circulation. Why is the heart described as a double pump? A. Each side pumps a different type of blood. B. It beats twice for each circulation. C. It pumps blood through 2 aortas. D. It has 2 sets of valves. Correct answer, A. The right side pumps deoxygenated blood to the lungs, while the left side pumps oxygenated blood to the body. What is the function of the pulmonary arteries? A. Carry oxygenated blood to the body. B. Carry deoxygenated blood to the lungs. C. Return oxygenated blood to the heart. D. Supply blood to the heart muscle. Correct answer, B. The pulmonary arteries carry deoxygenated blood from the right ventricle to the lungs. What is the main function of the conducting system of the heart? A. To supply oxygen to cardiac muscles. B. To produce hormones. C. To pump blood through the lungs. D. To transmit impulses for myocardial contraction. Correct answer, D. The conducting system ensures transmission of impulses that trigger myocardial contraction and coordinate heartbeat. What is cardiac cycle? A. The movement of blood in veins only. B. A series of sequential events involving contraction and relaxation of the heart. C. Contraction of skeletal muscles. D. Blood oxygenation in the lungs. Correct answer, B. The cardiac cycle includes all events of atrial and ventricular contraction and relaxation to circulate blood. How is cardiac output calculated? A. Stroke volume times heart rate. B. Stroke volume divided by heart rate. C. Heart rate divided by stroke volume. D. Blood pressure times heart rate. Correct answer, A. Cardiac output equals stroke volume times heart rate. What is peripheral resistance? A. Resistance of veins against venous return. B. Pressure inside the ventricles. C. Force offered by arterioles against blood flow. D. Resistance of heart valves. Correct answer, C. Peripheral resistance is the force arterioles offer against blood flow. What is the primary function of the heart? A. Store blood. B. Circulate blood to all parts of the body. C. Produce hormones. D. Filter waste. Correct answer, B. The heart is the principal pumping organ that circulates blood throughout the body. What is the mediastinum? A. Space within the lungs. B. Upper chamber of the heart. C. Space between the two lungs. D. Diaphragm. Correct answer, C. The mediastinum is the space between the lungs where the heart is located. What is the outermost layer of the heart called? A. Endocardium. B. Myocardium. C. Pericardium. D. Epicardium. Correct answer, C. The pericardium is the outermost layer of the heart. What is the weight of an adult heart? A. 270 grams. B. 150 grams. C. 300 grams. D. 500 grams. Correct answer, A. The adult heart weighs approximately 270 grams. Which chamber of the heart has the thickest myocardium? A. Right atrium. B. Right ventricle. C. Left ventricle. D. Left atrium. Correct answer, C. The left ventricle has the thickest myocardium as it pumps blood to the entire body. How many cusps does the tricuspid valve have? A. 1. B. 2. C. 3. D. 4. Correct answer, C. The tricuspid valve consists of 3 flaps or cusps. Which arteries supply blood to the heart? A. Pulmonary arteries. B. Coronary arteries. C. Jugular arteries. D. Carotid arteries. Correct answer, B. The right and left coronary arteries supply the heart with blood. What type of blood is pumped by the right chambers of the heart? A. Oxygenated. B. Deoxygenated. C. Mixed. D. Filtered. Correct answer, B. The right atrium and ventricle handle deoxygenated blood, sending it to the lungs for oxygenation. What happens when the left atrium contracts? A. Blood moves into the left ventricle through the bicuspid valve. B. Blood enters the right atrium. C. Blood moves to the aorta directly. D. Blood flows into the lungs. Correct answer, A. The left atrium contracts, sending oxygenated blood through the bicuspid valve into the left ventricle. Drop your score in the comments section and subscribe for more nursing questions.